Thank you, President. My question is directed to the Minister for Mental Health. Victorian mental health workers have resorted to industrial action after 7 months of negotiations to get a decent deal for the public mental health EBA. Unfortunately, the Victorian Government continues to utilise the Victorian Hospitals Industry Association as a bargaining agent instead of handling its own bargaining as the employer. Mental health workers are subject to increasing levels of occupational violence, are underpaid and overworked, and too many workers burn out and leave the sector. Along with provisions to address the stagnant wages, mental health workers are demanding improved staffing ratios and measures to ensure that their workplaces are safe. The response from this government is a substandard wages offer that doesn't even come close to key staffing and safety issues. Can the Minister explain why this vital sector is once again caught in protracted bargaining?
Minister.
Thank you, President, and I thank Mr Ettershank for his question. And as I've said in the Parliament and outside the Parliament many times, I've got nothing but the highest amount of respect for our mental health workforce. They are the backbone of our mental health system. They do incredibly challenging work, and it's often when consumers are at the lowest point in their lives. So you will, as I've said before, never hear a bad word out of my mouth when it comes to the skills and the dedication of our mental health workforce. It's one of the reasons why we have invested over $600 million to both skill up, retain and attract new workers to this sector. And that's seen a workforce growth of 25%, which is, I think, around double historic averages. So that is certainly evidence of our strong support as a government for the workforce in this sector. I absolutely support the right of those workers to collectively bargain through their unions, and that process is continuing in good faith. In relation to the VHIA, what I would say to you, Mr Ettershank, about that is that it's appropriate that they are involved, given that there's 18 separate health services that are involved in the bargaining and that the employment relationship is directly between those workers and those health services. They do play a role, but of course, with all health industrial bargaining negotiations, we do have our departments involved, and the Department of Health officials are certainly in attendance at all of these meetings to ensure that the bargaining is continuing in good faith and is fair, and that the outcomes for our mental health workforce are appropriate. And I'm confident that the fortnightly meetings that are continuing, or actually I think it's twice weekly, that the meetings are continuing, and that we will be able to resolve this agreement in terms that are acceptable and reasonable and fair to this amazing workforce.
Mr Ettershank, supplementary.
Thank you, President, and I thank the Minister for her response. The 2020 EBA negotiations lasted for more than 2.5 years as the VHIA dragged out these negotiations, with no consequences for them, but with painful consequences for the workers who waited years for a pay rise. This time, unions asked that a former commissioner be present to speed up the bargaining process and ensure that no agreements or clauses got lost, as happens all too often. Unions and workers want to see this EBA give life to the recommendations of the Royal Commission, an outcome the government surely desires as well. Yet after 7 months of negotiation, the current offer fails mental health workers and does not progress the objectives of the Royal Commission recommendations. Notwithstanding the range of health services involved, why does the government continue to outsource its bargaining responsibilities to the VHIA, who have well demonstrated form in drawing out negotiations to the detriment of our health workers?
Minister.
Thank you, President. I thank Mr Ettershank for his supplementary question, and I certainly wouldn't characterise the role of the VHIA as some sort of outsourcing arrangement. There are direct employment relationships between the workforce covered by this particular industrial instrument and individual health services, and you know it's not for me to say that the VHIA ought not to have a role, given that health services have supported their role as the peak in these negotiations. What I will say, though, is that following representations from the unions, I was very happy to facilitate former Fair Work Commissioner Michelle Bissett, who's a highly regarded industrial relations practitioner, to be involved in the bargaining to facilitate those talks, because we all want to see a swift and fair and reasonable outcome to these negotiations.